So this would be the, I guess, interim COVID-19 update since we met last week. Next slide, please. So normally I would start with a national and state picture, but since it's only been a week and we're focused, especially right now, on what's happening locally, I thought I would really start there. In the past week, we've had 24 additional cases, no additional deaths, and we are sitting at 37 active cases as of yesterday. The hospital does have 2 COVID inpatient as of yesterday. The 2-week percent positive rate is down to less than 2%. I do want to kind of put that in context, that percent positive rate is determined based off the number of tests and those number of positive tests. And overall testing has dropped significantly, which has also been a factor in that lower percent positive rate. And the 2-week incidence rate is 55 per 100,000. An additional note, although we haven't seen any variants here in Saline County, the state currently is reporting 76 cases due to variants in 14 counties, and then there was the press release on Friday of the first case of the South African variant here in the state. Next slide. So just kind of looking at that percent positive rate, those 2-week incidence rates, and then the hospital capacity, excuse me, over time. So we can see over time, and this is from reporting date February 8th, so last couple of months. I couldn't go back much further because then it definitely would have not been readable on the slide trying to put that much in there. However, you can see that we have had a steady decrease in the percent positive rate. The 2-week incidence rate as well has showed a steady decrease, and is the one that we reported yesterday was just a slight increase, and the hospital is still, for the last several weeks, reported a capacity greater than 30% to be able to handle patients. Next slide. So looking at cases per month, so far this month we have had 17 new cases in the month of April. Next slide. At this point, we've had no new deaths in the month of April. Next slide. Just taking a look, this is a snapshot from our GIS dashboard that's on the website. And you can see that continued downward trend of active cases over time, as well as the daily case rates that we have experienced. And the last 3 reporting periods, which would be those last 3 yellow dots, represent 23 active cases, and then 33, and then currently 37 active cases. Next slide. The same, looking at hospitalizations over time. We are starting to see small periods where a day or two that the hospital has 0 COVID patients, which was reported on Friday, but then over the weekend into Monday they had 2 that were admitted for COVID, but they are still able to handle what they have for quite a little bit still. They've got pretty good capacity still. Next slide. So rather than just the single, pretty much straightforward recommendation, if you will, that I have put forth in the past, I have brought you some options this morning for consideration. Course of action 1, and these are just options. Again, there's these 3, but again, it's your resolution. But option 1 would be to continue the mask resolution until we get reach a target of 70% of adults vaccinated, multiple days without cases, and the vaccine demand is satisfied, or to that one, which is what we have talked about in the past. Course of action 2 would be continue the mask resolution, but set an expiration date in 1 to 2 weeks. This would allow organizations that wish to continue any type of internal masking policy or whatever they want to do to be able to implement that, and then issue a strong recommendation for continued mask wearing. And course of action 3 would be to drop the mask resolution now, but still issue a strong recommendation for continued mask wearing. One note I want to make on the 70%, truly if we were trying to reach herd immunity with vaccinations, we would really be looking at 70% of the entire population. This 70% of adults vaccinated is certainly a lower standard than that 70% of the entire population. But given that we can't vaccinate under 16 because that's not available, this at least was a target that we could potentially try to reach. Last slide. And so regardless of your decision, I would continue to strongly recommend that people wear masks and follow all other public health recommendations, such as social distancing, hand washing, staying home when sick, and definitely get vaccinated. And with that, are there questions from the commission?
Yes, I've many phone calls, emails, but what keeps coming up is that if we do take away the mask order and like your COA to 1 to 2 weeks and give companies, businesses, schools to make policies, what if this does go away? What are they able to go ahead and have a mandate for their business or the whole school district or whatever, and without any ramification back from the state or people? Any lawsuits or anything like that?
Maybe I'll try and handle that one, Commissioner. Philip Smith, Haines County Administrator. So businesses are private property. A business can require you to wear green to come on their property. I mean, that's,
Yes.
It's free enterprise. So as for schools, the latest state legislation appears to give school boards the authority to enforce health protocols in schools. However, I did see an article this morning that a number of those are being challenged, particularly in the metro areas. So I think it's sort of an open question what the courts will find around schools' ability to enforce those particular types of policies. I think the same issue equally applies, for example, to the building authority. What would we choose to do with this building, other county facilities, et cetera. So anytime you have a public actor like a school district, they're held to a higher standard than a private business would be.
Okay, that's kind of pretty much what I had. So anybody else? Any other commissioners have any questions or comments?
This is Commissioner Vidrickson. I just want to say that I've had contact or been contacted by a lot of people, but the ones that stick out in my mind are the physicians in the medical field that have contacted me, and I would say there's, I'm not even going to guess how many, it's many, and 100% of them were in favor of continuing the mask mandate.
Okay. And, okay,
Jason, I don't want to muddy the waters any, but just for an education here, people who have contacted COVID and we don't know their immunity level or whether they can catch it again or how long their immunity level is. Is that correct?
Currently, the CDC and KDHE both, although they haven't fully determined how long immunity lasts, they have, however, for the purpose of establishing how long someone doesn't have to, say, for instance, quarantine if they're exposed again after having COVID as 6 months.
So if they do have some sort of immunity, I'm assuming, and maybe wrong, but if they do have that, could those numbers be factored into your herd immunity of 70%?
They could, yes. And so that would, I think, potentially put us at, now, again, not being able to account for, there's probably some overlap in people that have had COVID in the past since this started and who have also been vaccinated. But that could put us in the neighborhood currently, I think, of about 20,000 or so as a ballpark. I don't have that specific numbers in front of me, but that's my best guess right at the moment.
And we would like to hit 70% of our adult population.
Yes, sir.
And what would that number be?
That number would be around 28,000 or so vaccinated in order to reach 70% of the adult population vaccinated.
Well, it's very telling through the slides that the masks and the social distancing now with the tool of the immunizations have really dropped the numbers, and it's very evident that it has worked, and that is probably the most significant would be the oh man, that's a tough one. The immunization shots that people are receiving.
Yep.
yes.
Commissioner Shadwick here. I don't know how well you can hear me. My bandwidth seems to be low. Can everybody hear me?
Yes.
No, option number one seems unrealistic to me. I don't ever think of so many people that I've talked to are not even going to get the shot. I'm not so sure that that's a level that we ought to be shooting for. I would be in favor of either 2 or 3 at this point, depending on the conversation and some of the comments coming up. But I have noticed that increasingly social disobedience is happening on the mask mandate that maybe makes it almost a moot point right now anyway. That's it.
Thank you. Any other comments? Any comments from the public at this time?
Mr. Chairman, we do have a hand raised in the Zoom meeting.
Okay.
Renee Meyer.
Let's go ahead and take that and get that Zoom taken care of. Go ahead.
Hi. Yes, I want to say I strongly support the all of what the physicians are saying in continuing with option 1. I think, again, I keep going back to common sense and science, and the fact that our numbers have dropped have something to do with the fact that it's been mandated. So please, please, and I know it's hard for people who own businesses and such, but right now we have to hang in and stay firm, particularly with the new variants that are coming around. I'm afraid we're going to have an upsurge if we don't continue. One concern that was shared that I agree with from someone yesterday at the city meeting that was opposed to the mask mandate, she did share a concern about kids being allowed to play sports and being so close to one another and not wearing masks. That's never made sense to me either. But other than that, I do strongly encourage you to stay with option one. Thank you.
Okay. Any other Zoom?
Mr. Chairman, we do have a couple of hand raised.
Okay.
Aaron would like to speak.
Go ahead. Is anyone there?
Can you hear me? Yeah, sorry, I don't usually use Zoom. Can you hear me?
Yes.
Okay. I just wanted to implore you to do option 2 or 3, I don't care, but at least 2. I just really want a date on this. Even if it's a month out, we'd really all just like to see the light at the end of the tunnel. And that's all.
Okay. Thank you. Okay. Any other Zoom right quick?
Chad Ferber has his hand raised.
Okay, Chad.
Good morning, Commissioners. I know I've spoken to you a couple times about this, and I want to go on record again saying that this mask mandate has served its course. Mr. Tiller gave all of the numbers, and I appreciate him doing that. In fact, the health department puts these numbers out on social media for us regularly. I believe it's Monday, Wednesday, and Friday evenings. And I was doing a little bit of math on those, and they're monitoring 37 cases here in the county. And if you do the math on that, you're looking at 6/100ths of 1% of our population is being monitored for this virus, which means we have completely flattened the curve. Our hospitals are not overwhelmed by any stretch of the imagination. And that was kind of what we were wanting from this body when you imposed the mask mandate, was to put some type of closing date or ending date on this. And unfortunately, it was not done. And because of that, it has dragged on and on and on and on now for month after month. So I think it's time to relinquish this mask mandate, go ahead and move on. The citizens of Salina are smart enough to continue social distancing. There will be many that continue to wear a mask, and there's no problem with that. There will be many that choose that their business will require a mask when you go in there, and that is their prerogative. As was stated earlier, per Senate Bill 40, school districts have their own choice as to whether or not they require masking and distancing, that type of thing. Businesses, private entities do as well. I think we can look around the country and see examples. We can even look around our state. Down in Sedgwick County, they relinquished their mask mandate about a week and a half ago, I believe it was. On the day they stopped their mask mandate, they had 82 new cases. And if you look at their data from yesterday, they had 11 new cases without a mask mandate in place. It has still dropped significantly. Texas is the same boat. They dropped their mask mandate, and even with the surge of illegals coming across the border that are corona positive or COVID positive, their numbers are still dropping every day. And I think that goes to the point that citizens know how to protect themselves. We know to wash our hands. We know to social distance. We know to stay home when we're sick. All we're asking is to give us the freedom to walk around and make our own health choices.
Thank you.
I do like the idea of being in favor of having an end date. And if it's a week out, that's fine. It helps businesses to make a plan for themselves. But there just needs to be an end of this.
Okay.
Thank you, guys.
Thank you. And we'll move into the public forum here in the office here. Go ahead.
I'm Ken Ritz from Salina, Kansas. These numbers of cases, there's no way we can know how many people are homesick and haven't appeared on the list yet, or may never appear on the list. I'm not counted, and I had COVID in early January, and I'm not in the numbers. What I've noticed is that it's gone from last summer. I didn't know anybody who'd had COVID-19, and now I know of entire families. So I think we're undercounting tremendously. But interestingly, There are parts of the world that are free of COVID-19, entire countries, and they did it without a vaccine at all. And I think it would behoove us to maybe look at those who have been successful and see what they did. And these aren't little islands in the middle of the Pacific. New Zealand that people think of quite mistakenly, and I did too, of just being a few country folk with sheep and what have you. There are over 5 million people in New Zealand in an area larger than the state of Kansas. And they've been free of, they've had 25 deaths total since the beginning. And they haven't had a new case in months. They've been almost a year with just a handful of cases. And I would suggest that they live much as we do. There are farmers, there are bankers, there are members of civic organizations. I'm sure the Lions Club is quite substantial there. It's international. It would behoove us, I think, to go online or get on the phone and call people like us in these countries and get some idea. Because there are parts of the world that things are getting very much worse, including in the U.S.
Thank you. Your 3 minutes are up. Ken.
With the virus being in the
Your 3
air-
minutes are up. Thank you.
Okay.
Thank you. Sorry. But yeah, we need to go on. We got quite a few people
Okay.
to talk. Thanks.
Okay, well, I guess we can live
Yep,
in
thank
whatever
you.
world we want to.
Yep.
Dennis Benoit. I live in Geneseo, but I was born here, so I consider this my hometown.
Okay.
I have a question for Jason. Could you please repeat what you just said about immunity on the Pfizer and Moderna shot? You are familiar with they are gene therapy, and they don't deal with immunity.
Mr. Chairman,
Yeah, sir.
if he could make his remarks to us.
Yeah, I was just going to say, when we have this public speaking, it is to do with, to the commissioners.
Oh,
and
yeah, but, okay, well, I'll tell you that
Just ask us, and
this is,
if we decide that we need to have him, but could you move that microphone over
Okay.
where you, there you go.
this is gene therapy. This is gene therapy vaccines, the old vaccines that you grew up with, where you stick yourself and you get an immunity, is what he was talking about. I need it verified that the Moderna and the Pfizer are not involved with the immunity. That old definition is tossed out. This is the new stuff. This is a gene therapy. And so what, I just want him to confirm what I thought I heard him say. Because this new stuff is revolutionary, and it's experimental, and the people are not informed about what they're getting. The people in our community are you being used as guinea pigs if they don't let you know, give you the information for informed consent. Now, that's what my concern is.
Okay. All right.
Thank you.
Thank you.
Rosemary Mai from Salina, Kansas, and I strongly urge you guys to go with option number 3. I think, like Chad said, we are all responsible adults, know how to handle our lives, and if those people choose to continue to wear their mask, let them wear their mask. Let us that don't want to wear a mask go without a mask, same way with businesses. If they want people to come in with masks, let them allow that. But let us have a choice of what we want to do with our lives. Thank you.
Okay, thank you. Good morning.
Good morning, Dalton, City of Salina. It's up to the City of Salina. Flat out said that they're waiting on the county to act on something. Why don't you guys just act and see what happens? Last time when you guys did not do the mask law, then Commissioner Hodges then at the time, Commissioner Hodges pushed the mask law, and then you guys brought yours on. Jason has contradicted himself so much, it's comical. Do something, because obviously half the people in this room don't want to wear masks. You guys are probably getting emails all the time. And Jason knows dang good and well he's not going to get 28 or 29,000 people in the city in Saline County to get vaccinated. When's this going to end? When all of you guys are off commission and there's a new commission, and they put Jason in his place? Why don't you get some medical experts that have fought the virus from Saline Regional, and not Jason? Because obviously he has a different priorities.
Okay, thank you. Good morning.
I'm Dr. Kraft with Saline Family Health Care Center. I'm part of the collaborative to try to vaccinate Saline County. I'm a Saline County resident. Thank you for your time this morning. I come to you as the County Commission in a spirit of thanks. The actions that this body took to support a mask mandate have saved hundreds of lives of Saline County residents. Hundreds of people today have the liberty to live their lives because of this body and the decisions that were made. We're currently in a situation where businesses are able to open up more freely and citizens feel safer out in public. You struck the right balance between individual liberty and the common good, which is your duty as a county commission body. The current best evidence suggests that at least 70% of the population needs to be vaccinated to reduce the COVID transmission rate to the point where we can end this pandemic while we as a society go without masks, which is what we all want, to go about our days without masks. Saline County has not reached this minimum level of vaccination. Taking steps now that will decrease mask wearing in public before we reach this level of vaccination level leaves us vulnerable to another wave of COVID, particularly when there are more transmissible variants on their way to Kansas. I urge an extension of the mask mandate as our best chance to bridge us to the day where we have sufficiently vaccinated society and can safely leave the masks behind. Thanks.
Okay, thank you. Any other comments? Okay.
Good morning.
Good
My
morning.
name is Carol Woody, Saline, Kansas.
You bet.
I understand what everyone's saying. I agree with Chad. I'm only making a statement that I don't think we're ever going to get to the 70%. I don't think it's feasible. I'm asking, let people choose. They're adults. We all know to wash our hands. We all know to stay how many feet apart. We've got a positive rate now. Please, just let the adults make the choice. Let the kids outside to play. The sun, the fresh air is going to help them more than anything without masks. We've just got to come to an end sooner rather than later.
Okay.
Thank you.
Thank you. Okay.
Karen Shade, Salina, Kansas.
Good morning.
In the course of my life, I've worked for 3 lieutenant colonels. And what differentiates a lieutenant colonel from a full colonel is the ability, a full colonel will lead people into battle. And I worked with one lieutenant colonel who was very good at seeing the way the wind blows and kind of following what the public would accept. And I agree with Commissioner Chadwick that the public's ready to be done with masks. But I think your role as leadership is to marshal the public through, we aren't through this COVID matter. And I can live with either way you go, but I think leadership requires something more from all of you. And I've heard a lot of people say individuals can make their choices. I have a degree kind of in the medical field, years of experience in the medical field with working with a decade's worth of state. It's not that clear to me. And, you know, I think you've heard the local expert, we've heard our own. I think we have to go with what they say.
Okay, thank you. I just want to ask Mr. Tiller another thing. Have we had, it looks to me like we really haven't had any major increases in the COVID cases since like I was saying last week, since we had the Equifest, since we had the 4-H, or not the 4-H, but the farm show. And every week I go to the Liberty football games. And I look at it and I sit around and look in the stadium to see how many people have masks on. Almost zilch. But some people, they have to have them on to get in there, but then they take them off and they run around all day long and nobody has masks on. And that's the same way we're sitting here as a community and we look at it, and I look at it as that we draw in so many people from so many counties, whether it's events on sports events, and somebody talked about how, you know, to think that schools have allowed wrestling all year long, basketball, and these kids are all over each other, and so I just look at it, there's got to be something to those counties that did not have mask mandates, that did not have, and their cases have been just as low or lower than people that had them. And if we have not had any big increases in those since we've had these big gatherings, I'm ready to sit and say let's look at it seriously and do away with it. But I just wanted to say that. But go ahead.
No, I was just going to say, just in response to that, no, we don't have evidence that there has been outbreaks related specifically either to those two events, Equifest and the farm show that you mentioned. That being said, as I mentioned earlier, testing here has been significantly down.
Yep.
You know, whether any of those were tested somewhere else.
Yep.
So remember that the evidence is only as good as the data and follow-up. So to your point, no, there hasn't been evidence of a significant spread or outbreak from either of those events. But there's also not any data to support the opposite, that there wasn't any kind of spread at those either.
Okay. Thank you. All right. I look at it as, do we have a consensus on to move in one direction or the other?
Mr. Chair, I'd make a motion.
I'd accept a motion.
I move we rescind Saline County's mask order effective immediately.
So you're asking for the COA 3 immediate removal?
Correct.
And do we get a second on that?
This is Commissioner Shadwick. Was the motion to immediately
Yes.
take it down?
Yes.
I'm in favor of doing it in a week or two, so I will not second that motion. I just wanted to make sure that I heard it correct.
Okay.
Sounded like it died for lack of a second.
We died like a second.
Phil, can you help us out here a little bit? In time frame, week from now, I mean, we've got to clean this up or do another resolution, I'm assuming.
Well,
This is Commissioner Shadwick again, and to follow up on that, I move that we remove the mask mandate and put in a 1 week time frame.
I'll second that motion.
So if I'm understanding the current motion on the table correctly, you would basically be amending resolution. This would essentially be amendment number 2 to resolution 20-2297, which would essentially add a paragraph with the end date of April 12th or 13th, whatever. I'm thinking that's the action that you're taking.
That'll work. Thank you for the clarification, Phil.
Okay, we have a motion and a second to use COA 2, and I will say in 1 week, allow for the businesses to get everything built. So it's like in 1 week, we will have the masks, and that's the motion. Are there any?
Mr. Chair?
Yes.
Clarification.
Okay.
I thought it was option number 3.
No, 3 was the get rid of it right now. 2 was 1 or 2 weeks. And that's what Monty Shadwick did, and you second.
I stand corrected. Thank you for the clarification.
Okay.
This is Commissioner Chadwick, and that is a proper recap of my motion. It's basically option 2, putting a 1 week time frame.
Yes. Are there any further comments from commissioners? If not, we'll call for the vote. Commissioner White?
Aye.
Commissioner Weiss?
Nay.
Commissioner Vidrickson?
Nay.
Commissioner Shadwick?
Aye.
Commissioner Sparks? Aye. Motion passes 3-2. Okay, thank you.